We just heard from House Speaker Mike Johnson about the potential for a government shutdown happening later tonight. Joining us right now to discuss it all is House Minority Leader Hakeem Jeffries. And, sir, thank you for being with us today. I'm not sure if you heard what Leader Johnson had to say on some of these issues, but if you didn't, I'll kind of give it back to you. He said that this is a clean, continuing resolution that's been put forth. It's the same thing that the Democrats voted for 13 times under Biden. That this would keep the House open, you could continue, would keep the government open, you could continue to negotiate. And he said that this is being done for pure politics, for Chuck Schumer's backside, I think were his exact words on this. Would you care to respond to that, sir?
Well, that's all a lie. It's not a clean, continuing resolution. In December of last year, Democrats and Republicans actually passed a bipartisan bill that was signed into law by President Joe Biden, and also had the blessing of then President-elect Donald Trump. That is the actual baseline of a bipartisan agreement. What the Republicans are attempting to continue at this point in time is a March partisan Republican spending bill that Democrats in the House of Representatives overwhelmingly rejected because we viewed it as an attack on veterans, an attack on child care, an attack on housing affordability, and an attack on the health care of the American people. It's not a bipartisan spending agreement. It was a Trump partisan spending agreement. And we've been very clear as Democrats that we are ready, willing, and able to try to find a bipartisan path forward to reach a spending agreement that actually meets the needs of the American people in terms of their health, their safety, and their economic well-being, particularly in an environment where the cost of living in this country is already too high, America is too expensive, and Republicans haven't lowered costs. Costs are increasing. But we will not support a partisan Republican spending bill that continues to gut the health care of the American people.
He said on the health care front that there is room for negotiation with the ACA, but he said that that deadline is not until December 31st, when the existing tax benefits would fall off. He says that that should be negotiated separately and that they won't do it while there's a shutdown of the government. He also went on to say that this is in writing and from the Democrats, that they want health care for illegal immigrants to be part of this. They want to gut $50 billion that was included in the big, beautiful bill for rural hospitals, and that they want money there for corporate public broadcasting as part of this, too.
The one big, ugly bill represented the largest attack on Medicaid in American history, the largest cut ever. Hospitals, nursing homes, community-based health clinics are closing all across America as a result, including in rural parts of the country. That one big ugly bill actually stole food from the mouths of hungry children and seniors and veterans. And all of this was done so that Republicans could reward their billionaire donors with massive tax breaks and in the process skyrocket the deficit by north of $3 trillion. It was entirely irresponsible. It hurts everyday Americans who we should be standing up for in order to reward the wealthiest people amongst us. That's not an acceptable thing. And that's the climate and the environment that we're walking into. That said, we, of course, are willing to try to find that bipartisan common ground. But the urgency as it relates to the Affordable Care Act tax credits relates to the fact that beginning tomorrow, notices are going to go out to tens of millions of Americans, and it's going to be clear to them that their premiums, copays, and deductibles are about to skyrocket, thousands of dollars in additional expense in an environment where life is already too expensive for the overwhelming majority of the American people.
Is it true that you want to restore American taxpayer benefits to illegal immigrants?
Of course not. And thank you for asking that question, because this is also an outright lie. Federal law prohibits the use of taxpayer dollars to provide medical coverage to undocumented individuals. That's the law. And there is nothing in anything that we have proposed that is trying to change that law. We are fighting for the health care of the American people, fighting to deal with the Republican health care crisis, which included the largest cut to Medicaid in American history, It includes the fact that Republicans have refused to extend the Affordable Care Act tax credits time and time again, putting in jeopardy the health care of tens of millions of Americans. It's the fact that Medicare is going to face a $536 billion cut at the end of this year if Congress doesn't act because of what Republicans did in the One Big Ugly Bill. Our fight relates to the fact that hospitals and nursing homes and community-based health clinics are closing. No one in America, the wealthiest country in the history of the world, this great country of ours, should die because they can't find a bed or a room at a hospital because their hospital has closed as a result of what has happened with this Republican health care crisis. And on top of all of that, we see that Republicans have actually launched an assault on medical research in the United States of America in the Republican appropriations bill that is part of this process.
Minority Leader, let me just ask you, I'm going back and just looking at this. I think the questions about illegal immigrants getting these benefits go back to a term that's in your proposal that you've put forth that says legally present immigrants are eligible for all of these subsidies. And there's a big question about what lawfully present means. Does that refer to people who are here under the Deferred Action for Childhood Arrivals programs? I guess there's different descriptions of what people see. What does that mean to you, a lawful preference? Would it refer to DACA?
We had a meeting with the President of the United States yesterday and made clear, we're not trying to change current law. We are fighting to protect the health care of the American people. In rural America, in suburban America, in urban America, in small town America, in the heartland of America, in black and brown communities all across America. That's what we're doing. That's what this fight is about. Mike Johnson, but we have a very positive, forward-looking, communicative relationship, but he's been making the point that health care is an extraneous issue. No, health care is not an extraneous issue. It is a central issue to the quality of life of the American people. We don't want to shut the government down. That's not our approach. But Republicans control the House, the Senate, and the presidency. If the government shuts down, it's their decision to do it.
But this is a continuing resolution, and it's going to happen. All these things that you want to do, there's no way any of them are going to be negotiated by the time this happens. And if you shut down the government, last time, Democrats point out, you lose FEMA, you lose troop pay. You lose all these different things that are so important to Democrats when they're on the other side of this. If you're not going to get all these other things settled, you need to do the CR to get the government funded and then return to this and do it in the normal course of business for Congress. What is it that would get you to yes? I mean, and I think that you kind of danced around the illegal. You do want to provide health care to illegal immigrants that are here right now.
That's a Republican talking point, and it's shameful that you would continue. Of course not. I just said repeatedly that it is not. And we made that clear in the Oval Office to President Trump and to Republican leaders. We've made that clear repeatedly. It's a Republican talking point. In fact, I'm being gentle. It's a lie. We are fighting for the health care of the American people. And what we need to do is to address the Republican health care crisis.
What do you need by tonight to get
I'll tell you what
yes?
we need by tonight. Speaker Johnson should call Republican members of Congress back from the vacation that they're on. They were supposed to be here. We were supposed to have votes yesterday and today so that we can actually arrive at a bipartisan agreement to keep the government funded and to do it in a way that actually enhances the quality of life of the American people. So that would actually be a useful first step.